Hello. If you are interested in learning a little bit more about the second entry nursing program, you are in the right place. My name is Allison Ozog. I'm one of the recruitment and liaison officers in the Faculty of Health, and I'm very excited today to pass it on over to the second entry nursing program director, Irfan Aslam. So I'm going to pass it over to Irfan now as your presenter.
Alison, thank you so much. Thank you kindly for the introduction. Let's speak about the second entry nursing program. And in fact, let me step back before we speak about the program. Let's talk about the profession, because this program is there to get you into the profession of nursing. So we should first talk a little bit about the profession. Nursing profession is in demand. You must have read in the news, and it has been in the news for the last at least decade, how there's a shortage of nursing staff. This shortage is projected to stay at least for the next 2 decades. To give you an idea about how short we are in terms of nursing staff, we need 28,000 nurses by 2028, new nurses by 2028, and we will be about 18,000 short. What that means is there will be a demand for nursing. What that means is just like today, when people are graduating from the nursing program, within 3 months after graduation, almost 99% of the graduates are finding a job. So this would continue. In addition to that, nursing as a profession is also changing. There is more leadership roles that are involved. Nurses, especially RNs, they are working in managerial capacity, administrative capacity, and that would continue because you are being trained to take on those roles as compared to some of the other nurses like RPNs. They will be able to take the frontline clinical role, and you'll be able to take the administrative role. So that transition will continue to happen. We also see that from within the profession of nursing, you have the ability to work in any areas that you like. You can work in the hospital, you can work in community, you can work in a clinic. If you want to work from home, you can work as a telenurse. So those things are also available. So nursing as a profession itself gives you a lot of flexibility, and we are super happy about that. So let's talk about nursing and why would you want to consider doing nursing at York University? As I already mentioned, it's an in-demand career. You have a lot of diverse opportunities present. At York especially, you have a lot of support that is available. We have mentorship programs. We have mentorship program for alumni. We have mentorship program for the current students. And those programs are there to make sure that students are getting proper guidance as they are going through the program and even after they have finished the program. York University is in partnership with more than 90 different clinical placement partners. That includes all the large hospitals. You have a lot of smaller facilities as well. So by using those connections, we are able to pull some of the clinical placement. So if one of you wants to do a clinical placement, let's say you want to do a clinical placement in Kincardine, we are able to arrange for that. If you want to do a clinical placement in Barrie, we are able to arrange for that. We have clinical partners in those areas. There's an inclusive learning environment. And when we speak about inclusive in two ways. Number one is that students are coming from diverse background, diverse cultures. Most recently, like I'm teaching a class right now, and there are close to about 140 students in that, and they speak, like one day we were just counting how many languages they speak. They speak all together. Within that class, you have 67 languages being spoken. So that is a huge diversity that is present. You also have nursing philosophy, which is rooted in equity, diversity, social justice, and quality care. And we promote that. We are also very committed to excellence. When we speak about excellence, it's not just a matter of program excellence. We are continuing evaluating our program. We continue to ask our students for more feedback, ask our faculty members for feedback, ask our clinical faculty for feedback, as well as our clinical placement partners for feedback. So it is through feedback that we can continue to improve our processes and make sure that every cohort that is starting, they are getting better education than the previous cohort because we are continuously trying to improve. And that requires a certain level of wisdom as well. And that wisdom has been built in within the School of Nursing, where we know that feedback is important for us to improve our practices. In terms of the second entry nursing program itself, at York University, you have 4 undergraduate programs. You have a direct entry program, collaborative program, IEN, which is Internationally Educated Nurses Program, and second entry program. So second entry nursing program is just one of the programs that is being offered at York, and we also have other programs. One of the good things about this program is oftentimes students share their classroom with people from other programs. So they get to learn. So for example, if you have an internationally educated nurse who had 10 years of experience and they are sitting in the same classroom as you, clearly their understanding of the material will be different and they'll be asking different questions. So this program allows you to have that opportunity. It's an intensive and comprehensive program. Students will be learning what they are supposed to learn in a 4-year nursing program. We have just compressed it, slightly edited it, and we are offering the same program in about 24 months. It's a comprehensive and intensive program. And you're going to hear this word intense quite a few times. So be prepared for that. The reason for that is because you don't have any summers off. So it's a 6-term program, and those terms are going to come one after the other. So you're going to start in the fall, and it would continue until the summer for the next 2 years. So there's no time off there. In addition to that, after you're done with the program, you will have the ability to contact CNO and tell them, hey, I have passed my Bachelor's of Science in Nursing degree. Can I please write the NCLEX exam? So this program gives you the opportunity to write that exam. After you clear the NCLEX exam, you will be given the title of registered nurse. There's an immersive learning environment, more than 5,000 square feet of a nursing simulation center. But more than that, if you look at the faculty member who are present there, clinical faculty member, there is no match for them anywhere else. In the course that I was just mentioning, we have 5 faculty members, and one day I just checked, and between the 5 of them, they have close to about 120 years of collective experience in nursing education as well as nursing practice. So that will clearly inform their practice. That will also inform how they are going to provide teaching to the students. So faculty is outclassed. Then we have innovative curriculum. We recently went through something called a curriculum modification. The reason to go through that curriculum modification is because at York University, we believe that we need to continuously improve ourselves. Every few years, the education and knowledge in healthcare is changing. And we see the examples of that. For example, like there was a time when people were feverish and they had chills, they will cover themselves with blanket. But later research, it has shown us that it probably should not be done, because if someone is running a very high fever, we need to cool their body down as quickly as possible. So they can take a sheet to keep themselves somewhat comfortable, but if they are wrapping themselves in blanket, that's going to increase their temperature. So those kind of things are changing all the time. So we had to go through a curriculum modification because we want to make sure that all the latest knowledge, all the latest research is included in the program, and our graduates are up to par to deal with the issues that we are facing in the current healthcare system. So that's why curriculum is innovative, and it's a curriculum. It's set up in a way that you can continue to have um, improvements. So this is College of Nurses of Ontario. Nursing is one of the professions that has been allowed to issue licenses. and is self-regulated. So nurses are doing it themselves. The way it's self-regulated is that the government has allowed nurses that you are capable, you have the information, you have the knowledge to run your own profession. So nurses in turn have formed this college. It's called College of Nurses of Ontario. They are going to issue you a license. They are also going to make sure that anybody who's carrying this license of RN, they are making sure that the public stays safe. They are following the standards of CNO, they are following the policies of CNO, and they are following the policies and standards that have been set by the best practice guidelines. So after you finish your second entry nursing program, CNO will allow you to write the NCLEX examination. And after you pass the NCLEX examination, you will get the designation of a registered nurse. And once you have the designation of a registered nurse, then we are regulated by the College of Nurses of Ontario. And I am one of the people who's regulated by the College of Nurses of Ontario because I'm a registered nurse as well. Let's look at the program overview. On this side, you can see the year one courses, and then you have the year two courses. Year one courses are mostly foundational courses. They are going to introduce you to Canadian healthcare system. They are going to introduce you to health assessment. You'll be doing a lot of health assessment with your fellow students. You'll be doing a lot of health assessment on the mannequins, which are available in the Nursing Simulation Center. You will learn about social justice, as I mentioned that York University is committed to social justice. So you learn about that. You learn about leadership, ethics. Those are the foundational courses. The belief is, and actually there's a lot of science to back this belief as well, that students need to have a good foundation before they can be sent to clinical placement to work with patients. Because if they don't have good foundation, then more than likely they are going to make mistakes. We want to make sure that the students stay safe as well as the patient stays safe. If we are making any mistake in a clinical environment, then someone has to pay for it. And that most likely is going to be the patient because they are getting substandard care. So what we do at York University is in the first term, you will be spending a lot of time in the Nursing Simulation Center. You will be learning these concepts. You will be getting the theory part, and then you will be practicing it on each other as well as the mannequins. And in the second term, you will start your clinical placements. So that's what we mean by when we say exposed to continuum of clinical experiences. Clinical experiences are also in a hierarchical fashion. So we start with a low intensity clinical placement, and then it will become more and more intense. Your placement can be anywhere in a long-term care facility, in complex care setting like rehab, in a medicine unit, in a surgical unit, community health, mental health. So those placements will also be present. The idea there is to keep you safe, to give you enough knowledge. So when you go for a clinical placement, you feel comfortable practicing. Then in year two, you have more advanced courses. And remember the concepts that have been written here for year one, they will be delivered over 3 terms. So you will have fall term, you will have winter term, and summer term. Similarly, the concepts that are written here in year two, they will also be offered in 3 terms: fall, winter, and summer. And here we are talking about advanced. So you'll be learning about pathopharmacology. You will have the ability to get into streams related electives. So at York University currently, we have 2 different streams. So you can get into mental health stream. There are some students when they come in because of their previous background, they know they want to get into mental health. There are some students, they know they want to get into acute care. So we have those streams and students will be able to get in those streams as well. Let's take another look at the concepts that will be covered, but this time it's in the form of courses. So in term number 1, semester number 1, you will be taking these courses. As you can see, 5 courses in semester number 1. And for the next 4 semesters, you will only have 4 courses each. The reason you only have 4 courses each is because the course at the bottom, the one that is highlighted, over here, 3510, 2547, 3511, 4526, and 4527. These are clinical courses. In these courses, you will be spending 1 day in the class, and you will also be spending at least a day in the clinical setting. So that is going to take more of your time. That's why the number of courses over the next 4 terms is down to 4, and then in the last term, it's down to 3. The courses are built on top of each other. For example, when you look at this, it says pathophysiology and pharmacology and knowledge integration 1. This is knowledge integration 2. This is knowledge integration 3. So courses are building on top of each other. This is one of the reasons why in order for you to take 2536, you must pass 2535. So those are the prerequisite courses that need to be done. There are some courses which are core requisites as well. For example, when you are taking health assessment, it's a good idea to take reflection and theory with health assessments. So they become core requisites. So there are some courses which are core requisites, some courses which are prerequisite. And what we want to make sure is that you get enough knowledge in the first term so you can successfully move towards the second term, and you can work with communities, you can work with the, you can do your community assessment, you can complete that course successfully. And from there, you will get enough information that you can go and do your mental health placement in a mental health institution. So we are preparing you. This type of organization is called scaffolding. So if you look at a building that is being built, usually they have this metal setup where they will build the first floor and then the second floor, then the third floor. So this is what we have done with our curriculum as well. So in order for students to progress into the second term, they must complete the courses in the first term because second term is scaffolded on top of the first term, and so on and so forth. This is another thing. So this curriculum will be taken by all the students. There will be some students who may choose to get into the stream option because those students may already know that they want to either get into mental health or they want to get into acute care. So what is a stream option? Stream option is an area of nursing where students have the ability to practice in, they have the ability to get more information in, if they wish to do that. In order for them to do this, there are a few requirements. You must have at least a B+ average during the first year. So in these terms, you must have B+ average. In addition to that, you also need to have some interest in those areas that are being offered. People who do not have interest in acute care or mental health, they will continue in the regular stream. And in the regular stream, they will take 2 electives. They get to choose those electives. And then they will take their clinical in a regular placement area. That could be a medical unit, that could be a surgical unit, it could be a postpartum care unit. So it could be any unit. So any placement which will help them meet the course objectives for 4527, this course here, and 4530, they will secure a placement for them. Now, students who are in the elective, this is the difference here, optional streams. So right now we only have 2 optional streams. It will come later as well. So those streams are mental health, those streams are acute care. We are currently working on geriatric stream, and we'll also be working on pediatric stream. So we are hoping to introduce 2 more streams, but they haven't been completed yet. So students who are in the stream, instead of taking any elective, because in the previous one over here, they can take any elective. But here, instead of taking any elective, they will take elective which are related to their stream. So for example, if I am in the mental health stream, my first elective will be about mental health. My second elective will also be about mental health, and my clinical placement will be about mental health. Similarly, if I'm in the acute care stream, first elective is about acute care, second elective is also about acute care, and my clinical placement will also be about acute care. So again, as I mentioned, the scaffolding nature of our curriculum here. So the clinical placement is built on the electives, and you need to complete those electives before you can take that clinical placement. Another big component of education that is being provided and experiences that are being provided at York University includes Nursing Simulation Center. York University is Simulation Center can accommodate up to about 150 students. We have high-tech mannequins, these type of mannequins, as you can see, and these mannequins can breathe, they can speak. We have a lot of equipment where students can come and they can practice. What we are trying to do is before students go into a hospital to help other patients, they need to feel comfortable. They need to know how the bed works. As you can see on this bed, there are like 30 buttons. Like, what does each button do? We want them to practice those things in the lab where it's safe for them and it's safe for the patients. And then later on, they can go and practice. They will be practicing these skills in the lab in the presence of clinical course directors. These are the clinical course directors that have years of nursing experience. As I mentioned in my course currently, there are about 120 years of experience among 5 clinical course directors. In addition to that, there will also be some student volunteers in the lab who can provide help, and those student volunteers are usually coming from NSTEM, which is a mentorship program offered by the nursing students. We also have something called simulation. These are on-screen simulation. So this is simulation that is happening in person. You're going there, you're practicing, you have on-screen simulation, which is offered via various programs. vSim is one of them. The idea there is in these programs, you get to make mistakes. For example, there are 4 medications which are listed and the patient is having, let's say if a patient is having a stroke, and they have a facial droop, their arm is not working, their leg is not working. So what do I need to do? So the first thing that needs to do is I need to call code teal, but it would give me 4 options. Should I call code blue? Should I call code red, code yellow, or code teal? Now code teal is for stroke. I should be calling code teal, but let's say I don't know. So I push on code red and then it would tell me, okay, code red is about fire. So I get to learn about those things without having the intense pressure of being in the clinical environment. So I can practice those. I get to play with various options and I get to learn from those options. So that's why we are using on-screen simulations as well. This is another simulation which is used for mental health. Students will be doing their placement. They will also be doing their practice in person. But sometimes if they require additional information, additional practice, then we offer that practice through simulations. When we speak about clinical practicums, over here, let me take that. At the bottom here, if you look at all the highlighted courses, these are the courses which are the clinical practicum courses. So these courses are where you will be going to various clinical sites and practicing the skills that you have learned over this program. And those skills are offered in the class as well as in the lab. So you get to practice those skills in person. For example, in the health assessment course, we are going to teach you how to take someone's blood pressure, how to take someone's pulse. But it's in the clinical placement setting where you will actually go and check people's blood pressure, check their pulses. So placements are offered in various areas. Last I checked, we are offering placement in close to about 40 different areas of nursing. So placements offered in various areas. These are some of these areas are listed here. You have pediatric, mental health. And when I say 40, because mental health has its own specific area. For example, you may have outpatient mental health. You may have a mental health patient which is specifically for schizophrenic patients. You may have mental health which is for forensic patients. You may have mental health which is for pediatric patients. So each one of these headings will have its own subheadings. So these are some of the areas where the placements can be expected. What we are going to do is we are going to find a placement for you which is going to match with the needs of the course, which is going to allow you to meet the learning objectives of the course. So that's what we are going to do. In order for you to get to the placement, you need to have completed your prerequisites. So prerequisites for a placement is you must have a clinical preparedness permit. In the clinical preparedness permit, you need to have your immunization done, like hepatitis C, hepatitis B, TB, MMR, mumps and rubella vaccine. COVID vaccine you need to take. You also need to take latest flu shots. So all those things need to be done. Now, why are we doing that? Because we want to make sure that when you go to a clinical setting, you stay safe. You will be dealing with patients who may have COVID, who may have flu, who may have TB, who may have hepatitis B. And because nurses are dealing with blood as well as bodily fluid, so we need to be protected in order for us to work in those settings. So we want to make sure that you stay safe. Most of the clinical courses, they will be 144 hours in duration, and it will be structured in about 12-hour shifts. So basically, every week you will have one shift, so 12 shifts over 12 weeks. Whenever we are doing the clinical placement, those clinical placements are going to be offered in group setting. So when we speak about group setting, what that means is you're going to have 6 to 8 students on a unit. There will be one clinical course director, as you can see, one of our lovely clinical course directors here. And this clinical course director is there to make sure that students are practicing with care, with safety. The reason why we do that is because when you're starting on a clinical unit, you will have a lot of questions. You need somebody there who can answer those questions, who can guide you, who can introduce you to the routine. And our clinical course director will be able to introduce you to that routine. And they'll be there to make sure that all the practice that is being done is done in a safe manner. Attendance is mandatory when it comes to the clinical placement hours. We are making sure that within about 2 years, you get at least 1,100 hours of direct placement practice, direct clinical practice. This is 1,100 hours, which will be hands-on practice with the patients. NSE hours, they vary. Approximately 66. I have seen them even as high as 100, and sometime the lowest I've seen is about 66. So it will be close to that time. There are more simulation hours for some students. When I say approximately, the reason I've used the word approximately is because some of it depends on the student. So for example, there's a practice session that is being offered at the Nursing Simulation Center, but this is an optional practice session. So students have the ability to come. If they don't wish to come, they don't have to come. So those 3 hours, 4 hours that are being offered every month, that is up to the students if they would like to come or not. So some students are able to go and take those hours, and that would increase the number of hours that they have completed. In the last placement practice, they are going to do 360 hours over 11 weeks. So if you look at the 360 hours, it's almost like they are working about 33 hours per week. It's almost like full-time hours they have to work. Now, what are we expecting from our students when they go for clinical placements? They need to be prepared. Number one thing is when we are going to clinical placement, we are going there to take care of our patients. So we need to make sure that we are mentally prepared to take care of our patient. We also want to make sure that we are well rested. So if I have, let's say, if I'm working tomorrow and I am going to start at 7 o'clock, I need to sleep early at night. I cannot sleep at 2 a.m. and then wake up at 5 o'clock because then I will be sleepy while I'm working. In addition to that, I need to come prepared. I need to make sure that I go through all the theories that have been taught in the course. I need to make sure that I come in a uniform. I need to have my stethoscope on me. I need to have my blood pressure cuff on me. I also need to have a pen on me. I need to have a diary on me. I need to come prepared. I need to come there so I can provide care to the patient. And in addition to that, what we also are expecting, and I think that's a bigger expectation, is the attitude that students bring. There are some students who are going to come to a clinical placement, and they are there to learn. We know they are there to learn because they are asking the clinical course director, can you please tell me if there's something that needs to be done, I would like to go and do. They're asking other nurses on the unit. They're asking other nursing students, hey, if you need help with anything, can you please tell me? I would like to do that. They're asking other nurses, hey, if you're going to perform, let's say, catheterization or IV, can I please come and watch? I'm not able to do IV right now, but I would like to watch. I want to know how it's done. Those are the type of students, those are the type of learners who everybody prefers. The reason for that is they are so eager to learn and they are so enthusiastic about learning. They are so appreciative about learning. So we are hoping that when we go to the clinical practice, we take the same type of enthusiasm with us. And in the clinical practice, you will also be doing documentation. You will be speaking with the patients and their families. You'll be talking to other professionals, which like pharmacists, you may be speaking with the physicians, surgeons. So that will turn into a inter and intra-professional collaboration. So you'll be doing all of that. I'm going to take a little bit of pause on this slide. The reason for taking the pause is because workload is something that that is huge in this program. When I speak about huge, this is a 2-year program. There's no break in there. You don't get a term off. So this is a very continuous program, very course load heavy. It's being offered at an accelerated pace. It's being offered where the studies have been compressed. So you're getting more information in that small period of time. You have to do 1,100 hours of work. So think about it. Normally, uh, if you're working full time, you have to work close to about 2,000 hours per year. In 2 years of the second entry nursing program, you'll be spending 1,100 direct hours at a clinical site. On top of that, you'll be spending close to about 150 to 200 hours in the nursing simulation lab doing on-screen simulation. So all those things will be done as well. It is going to require you to be present. What I have seen is students have a lot more commitments. They have commitment to their family, they have commitment to their jobs. In those kind of situations, this program become very difficult. I have seen the students are able to do it, but in order to do it successfully, you need to have time to, so you can commit that time towards this program. If you're not able to do that, then you may not be able to complete the program, or if you complete the program, you may end up paying a high price for it. I have seen students who, like, there's actually a student right now who is supposed to attend a wedding. It's her, I think it's her sister's wedding, and that's happening next week. But her exam is on Friday, and she is preparing for that right now. So this programs ask a lot from you, and the reason why it's asking a lot from you is because it's a 2-year compressed program. If you think the compressed nature of the program is too much, then my suggestion would be that you need to apply to the 4-year program, direct entry program at York University, because that will give you the summers off. So you get 4 or 5 months off. If you need to work a lot of hours because you need to pay for your family, you need to pay for your own living, then in those 5 months, you can work as many hours as you like. And then you can come back to the program and take the program for 8 months and then go back and have a break. But in the second entry program, we don't have that kind of break. So that's one thing. Another thing I think that leads to increased workload is, I already mentioned about the clinical practicum, but about 70% of the program, 70% of the students who are in the second entry program, they're also working as clinical externs. Clinical externs are professionals who are working in the hospitals and they're helping nurses. There's a huge demand for nurses, and because nurses are not available, so now what the hospitals have started doing is they have started to hire nursing students. The starting salary is about $25 per hour, and the reason why they are hiring nursing students is because they know that nursing students are able to perform certain skills. So for example, if you've done a health assessment course, you can at least take blood pressure, you can check someone's pulse, you can check their temperature. You can answer their questions, and at least you can go fetch things for them. Let's say if they need a cup of water, you can go get that for them. If they need to go to an appointment, let's say they need to go to a CT scan, instead of a nurse accompanying them, you can accompany them in some cases. So that's why hospitals are hiring clinical externs. So 70% of the students are also working as clinical externs. So that also leads to increased workload for students. So this is one of the things that I mentioned to all the students as well. Make sure you also have time for yourself, because if you're spending, let's say, about 8 to 10 hours on school, you're spending 8 hours at work. You're only left with 6 hours, and in those 6 hours, you need to eat, you need to take a bath, you need to sleep, you need to do your laundry. That can be done for 1 day or 2 days, but if you do it for 2 years, that is going to take a toll on our health, on everything else as well. So workload is intense. Make sure you are in a mental space where you can commit. You also have the resources available where you can commit to this program. We also recognize that the workload is heavy. That's why there are a lot of resources available. When we speak about resources, they can be roughly divided into three. For example, one is access to the faculty. You will have access to the faculty member. Faculty members are on campus, as well as you can access them over the emails and via telephone. So you will have access to the family members. You can ask them for suggestions, for their advice, and they can become your formal or informal mentors. We also have peer support, which is available in the form of various organizations. You have Nursing Students Association at York that can offer you and connect you with resources. This student organization is representing all the nursing students at York University. Then you have NSTEM, which is the Tutoring, Ambassadorship, and Mentorship Program. These are the students who are able to offer peer tutoring. They are able to also provide mentorship in the nursing simulation lab. Then you have some of the other organization. I haven't listed all of the nursing organization. I just wanted to list the bigger ones. So I have listed these four. You have Canadian Black Alliance of York University. You also have Pan Asian Nursing Alliance of York University. So these students organizations are present at York. In addition to that, you have institutional support. So people who require counseling services are present. If you need any kind of accommodation, you have student accommodation services that is also available at York. Well-being resources are there. Health insurance is also provided. You have psychology clinic, you have law clinic. There are a lot of resources available. Think about York University as, and this is actually, here you can see, this is the York University subway, photo of the York University subway. Within that campus alone, you have close to about 70,000 students. So it's actually a city within itself. So you have a lot of resources available within that city, but you can only access those resources if you have time. So oftentimes it would happen where students are committed to their work, they are committed to their family, they are committed to their studies. They don't have the ability to access these resources because they don't have any extra time. In terms of career options in nursing, you can work in any of these areas, and there are more areas where people are working. People are like, recently I checked with a graduate and he's working with a insurance company. There's another graduate who's working with a pharmaceutical company. Other than that, majority of us, we are going to work in the hospitals. So there are good jobs available in the hospitals, and our job is, it's a government job. So you're working for the Ontario government, and it comes with good benefits, and it's a very stable profession. If you choose to study further, you can become a teacher, you can become a researcher, and you can, at any time, you can become an entrepreneur. So that is also available. Again, to provide you a quick summary, nursing is an in-demand profession. And this profession is going to stay in demand for many decades to come. The programs that are being offered at York University are some of the best programs you will find in the world. In addition to the program, you also have the ability to take advantage of the resources that are present on campus or the resources which are being offered by the students. There's a large student body of nursing students, and that student body is going to help you with understanding the concepts. They are also going to help you navigating your day-to-day life at York. You have clinical placements which are available in a lot of clinical settings. Some of those are listed here. You can work in hospitals, you can work in community, you can work in mental health institution, you can work in ICUs, emergency department, a lot of clinical placement. You also get to practice your skills in a nursing simulation lab. Those are the benefits of taking nursing at York University. And after you complete this program, you will have the ability to do your NCLEX program, NCLEX exam. And with that NCLEX exam, after you pass the exam, College of Nurses of Ontario will issue a registered nurse license for you. So you will be able to work under the title of a registered nurse. So those things are all available to you when you are in this program. Lastly, I will ask Alison to speak about this slide because this is about her.
So thank you so much, Irfan, for sharing us more about the second entry nursing program. If after today you have questions, I am here to help you. So, once you are a current student, you're going to have access to all the current student resources. You're going to be very well acquainted with the School of Nursing, the program assistant Heather, as well as the academic advising team. But while we're still kind of in this period where maybe you're still deciding if you want to accept or not, maybe you're still, looking at your different offers, I am here to support you. So you've probably got emails from me before, but just in case you haven't, that's my email. I also have our kind of general email inbox, which is hlthrec@yorku.ca. If you do want to book an appointment, you're welcome to email either of my email addresses and we can set that up. There's also my telephone number there. If you want to book a telephone appointment, that's available too. So thank you so much for connecting with us today, and we hope to see you studying with us in the second entry nursing program in the future. Have a wonderful rest of your day.